Well, welcome everyone. I'm Ann Metcalf, and welcome to Conscious Eating, Conscious Living. And it is now November 12th, 2023. Hmm, grand time to be alive as we shine our light, share our knowledge, and be courageous in those conversations that we need to have. Now, today's talk is came from a woman that I met a few years ago at a networking weekend online. Her name is Claudia oh, Moulimeg. Anyway, she has this program that she took from somebody else and sharing it with the world, and it's called My Holistic Vision. And she was able to heal, change her stigmatism in her vision, and no longer wears glasses. And so she teaches this program where people can improve their vision, and probably depends on what the original um, issue is. But anyway, she has a Wednesday Facebook chat with different guests. And this past week, she had this Dr. Rani Bannock, who shared her ideas. So I'll tell you about who this Dr. Rani Bannock is, and then some of the hints that she gave regarding makeup, and not so much the face makeup, but the eyes, because that is her field of work. And so I just have a listen. You can go onto her website later and check things out. So anyway, Dr. Rani Bannock, she's an integrative eye doctor, board certified ophthalmologist, and fellowship trained neuro ophthalmologist with additional certification in integrative and functional medicine. She focuses on the root cause of eye diseases and uses integrative strategies for conditions such as thyroid eye disease, macular degeneration, cataract, dry eye, glaucoma, and other autoimmune diseases of the visual system. Her treatments are based on nutritional, botanicals, lifestyle modification, essential oil, and supplements. Dr. Rani runs a private practice based in New York City, and she's also an associate professor of Mount Sinai, where she serves as an educator and researcher. And she's also a principal investigator of several clinical trials in diseases of the optic nerve. And she uses nanotechnology and gene therapy, amongst other things. So she had this chat with Claudia, and what she was saying is we need to use our eye makeup very carefully if you want long-term health in your eyes. And she no longer uses eye makeup. She doesn't use the liner and the mascara because she understands the risks what that does to the eye. Now, she's using the eyeliner contains a fine particulate matter, which makes sense because when you're putting that to make your lashes look longer, and that is an issue for the health of your cornea and the eye glands. And the eye glands, which are just sort of underneath your lower and your upper lid, and they secrete oil to protect your eyes. And it's very important not to block them when you apply mascara and eyeliner. And we've got their tiny little glands, and if you can find a close-up picture, she showed it on her presentation, and they just look like little lines all along the edge of your lid. And there's these meibomian glands. There's other glands, and they secrete oil. And if they don't secrete that oil, then people end up with dry eye, which is another sort of health hazard. Eye doctors, they check by pulling down your eyelid, and the black kind of lines that they can see are the glands in your eyelids. And the eyelid, the upper and the lower, they have about 25 to 30 glands in each lid. And when these glands dry out, become clogged, this can cause dry eye, styes, and the glands eventually die off, which is irreversible. You get one set of them, and that's it. Lipid scans can show what state of health your eyelids are in. So, if you go to an ophthalmologist, do you have a lipid scan done? And if you don't, ask for it. And lipid flow is a treatment that she recommends. It unclogs the glands. In addition, Dr. Manny was saying applying a bit of heat and gentle massage with the eyelids will also help unclog the glands. Now, she says when using the mascara, use outside of your lash line, so not right up close. And unfortunately, there's no real studies on gland loss. And some theories include hormones affecting them, excess screen time, or an autoimmune response. The latter means they actually don't know what the cause is, and they just call it autoimmune. Now, she also says buy your eye products from a reputable company. 2020 is one eye company that Dr. Bannock recommends. And she says don't use glitter makeup because some of them contain heavy metals that irritate the cornea and block the glands. It may look glitzy, but what are you doing in the long term? Especially young people who just think it's very glamorous looking, sparkly. You need to think about what's that conscious decision you're making on your health and your eyes. Do you want to be able to see clearly for the next 20, 30, 50, 70 years? Now, use your makeup in a safe way and make sure that it's not tested in animals. For eyeshadow, again, avoid the glitter-based eyeshadows because those specks get into the eye, they scratch the cornea, and for some people, there's allergic reactions to what is in that eyeshadow. One thing she recommended is perhaps a cream of the form. Generally stays where you put it, and it doesn't have those flecks. Use large brushes, and keep your eyelids closed, which seems to be a natural thing when you're putting on eyeshadow. The cornea is so sensitive, even to tiny particulate matter, especially in the powders, that it just goes through the eyelashes and onto the eyeball and the cornea. Now, the eyelashes, a lot of women are using lash extensions, and she talks about the many complications from them on that program with Claudia. And she says the glue can block the eyelid glands and styes form. And glue can irritate the skin. It pulls the natural lashes off. And with the lashes, there are extensions that use a magnetic lash. So there's something that put in above the line above, and it's magnetized, and the liner there's they actually stick on. She seemed to think that was okay, but she says there's not a lot of research done on our eyes and what the makeup companies are telling us to wear or not to wear. With a special remover to remove them, you want a safer, healthier mascara, and you don't want a coating of the cornea. That's really dangerous. And don't touch the waterline in your eye. So be very careful when you're putting that on. And some safe practices and cosmetic no-nos. Skin around the eye contains capillaries, and they break, which creates dark circles under your eyes. And rubbing your eyes, when they're itchy, you've got allergies, excessive rubbing also causes damage to the cornea. As she says, some causes can be hereditary. She says, take a cold compress instead, and it will constrict the blood vessels, which helps in preventing some of that stuff from going inside. And the warm compresses, the heat, loosens the clogged material. And cool is better for allergies. Eye bags are formed from fats, and the eyeball is cushioned by fat pads. And as we get older, it stretches out, and the fat comes forward into these eye patches. which is kind of interesting. And she was saying fruits high in salt, the fat pads will swell up as the salt sort of encourages the absorption of water, and obviously with the fat. The cold compresses, she was talking about a serum with caffeine that helps reduce the puffiness. So you can look at her website or check online and see what you can find for yourself. She says that bloodshot eyes are an allergic response in your eyelid. And there's a drops called Lumify, Lumify. You can get them over the counter and they're FDA approved. And it takes the red out by constricting the blood vessels. Regular use is not good. So only use it rarely because you're putting that right into your eyeball and you want to be very protective. Now, eyelash remover, one thing she suggested was castor oil. So an oil-based one. Take a cotton ball, rub gently with the eye closed to wipe off the excess. And makeup removers are not always sterile. So check the pH difference. It should be a pH balanced for the eyes, which is 7.2. And a note about baby shampoo, doesn't irritate because it doesn't have those, the irritating chemicals. And again, use a reputable company. And with eye drops, she was talking about be very careful. I guess that's used for lash growth. Again, you know what? Talk to your eye specialist and see what they say. Blinking and natural tears can help flush out. And again, just make sure it's a sterile eye rinse that you're using to clean your eyes with. And she said, Dr. Rani said, be proactive to prevent vision loss. And I will put her link on my Facebook chat. And she's got different health programs, some ones on eye on migraine. She actually wrote a book about carrots and other fruits and vegetables that help you eat the right foods to enhance your eye health. So check that on her website. And the little second note that came from Claudia, she has these Wednesday chats at 12 p.m. Pacific time. And she had a woman on, this from Cross Street, correct, to business, naturally with Esther Vanderwerf. And she shared some insights and techniques. And Claudia just briefly mentioned them in the email that I received from her. One was strabismus and non-surgical solutions. It's often that strabismus is treated with surgery as the only solution. But she says that the muscles of the eyes can be shifted naturally, and aligning the eyes can help eliminate double vision without the need for surgery. Exercises for eye muscles. She took the listeners through some fascinating exercises that intentionally make tension in the eyes slightly worse and then relaxing. And this helps us feel and move individual eye muscles, a skill that's crucial for improving vision naturally. Achieving depth perception was something else she talked about. And another one was tools for better vision. And some tools that can assist improving vision include the iPort device, which uses colored lights to help the brain switch between the eyes, and our lower tech options like the Brock string, a simple but effective tool with beads that guide your eyes. So you can check that out. And the other, number 5, was patience and self-care. And Esther left us with an important reminder to be patient with yourselves on this journey. These practices can be energy intensive, especially when starting out. So taking breaks, practicing relaxation is just as crucial as the exercises themselves. And Esther's wisdom has opened up a world of possibilities for those who seek to improve their vision naturally. And with Claudia's program, I started her program and I was using some of the exercises. She even uses one of those soft balls to actually stretch neck muscles because everything around your face, it's all connected. And the importance of the vagus nerve, I always found fascinating. So you can check out Claudia's Clear Vision Wednesday. And as Claudia always says, until then, blink and breathe. So check my the links that I'll put there. I sometimes put some of these chats on my app, Authentic Sacred Design. Any questions, you can always chat with me through rosiesjoy11@gmail.com. So take care of your eyes, be your own health advocate. You are in charge of you. And I would question all the food industry, the makeup industry. What's their due diligence? What research are they doing to tell you that this is what it should be? This is it. This is safe. So listen to your body, listen to your intuition. Is it saying, don't touch that? Try it. Be very careful with your eyes and your health. We have one body here and now, and let's treat it with just the utmost respect and honoring, and thank ourselves. Be grateful every day for that beautiful health that we have. So, have a wonderful Sunday. Blessings of joy, happiness, wellness, wisdom, abundance in all ways. And until we meet again, have a great day. Thank you.